welcome to the front row. Today we're going to talk about something I see quite a bit in the clinic, and that is a frozen shoulder. Okay, so if you've got shoulder pain, it can be a lot of different things, but a common thing that it can be is an adhesive capsulitis, or also commonly known as a frozen shoulder. It's important that if you think you have a frozen shoulder, that we get it diagnosed quickly, because from the onset of your shoulder hurting, or starting to freeze, if you will, to the frozen part, to the time it starts to thaw, can be up to 2 to 2.5 years. Okay, yeah, that's not so good. Okay, however, if you can catch it early, okay, it can significantly reduce the amount of rehab time. And also with physical therapy and exercise, you can really shrink that down. Okay, so let's quickly talk about what a frozen shoulder is. Basically, without getting too depthy, what it means is that we've tightened up the capsule of the shoulder, or the glenohumeral joint, and we've lost the normal rhythm of this joint. Okay, we've got a scapula right here. Okay, so it's called the scapulothoracic rhythm. The scapula just kind of glides on the rib cage. Okay, so what happens is this. In the first 60 degrees of motion, this is 0, this would be 90. In the first 60 degrees of motion, we shouldn't have any scapular movement. That should just come from the glenohumeral joint. Okay. After 60 degrees, what's going to happen is, for every 2 degrees this arm goes up, this scapula, okay, this lateral pole right here, is going to superiorly rotate. Okay, you can kind of visualize that as this arm goes up, the scapula has to rotate. This guy is fused, of course. Sorry, bud. But if he wasn't fused, you could see that happen. In a frozen shoulder, we lose that normal 2-to-1 ratio, and usually it drops down to 1-to-1. So what that means is, the moment he starts to elevate this arm, this scapula starts to go with it. Okay, so if we were watching movement from behind, okay, what it would look like is this. If I had my thumbs right here, and if he lifted up both arms simultaneously, if you don't have a frozen shoulder, okay, I'm going to get this nice lateral glide, superior motion of the inferior pole. If this right side is frozen, what's going to happen is, the moment he brings it up, my right thumb is going to jump way up if I'm tracking the inside of this scapula. Okay, if that's what happens, then I know that in addition to other stuff, I do have a frozen shoulder. Okay, so if you think you have a frozen shoulder, grab a spouse, a friend, hire someone, but have them check your scapula as you slowly lift your arms up, and you should see an equal movement. If one jumps up a whole lot higher, you've got some significant tightness through there, and it could be a frozen shoulder. Okay, I've got some video footage of an actual client that I saw, and you'll get an idea of what that looks like. Okay, so check it out.
So this was an actual patient of mine, and she was nice enough to let her use the footage. So she presented with pain in her right shoulder. So I'm going through the same evaluation process that I just taught you. So my thumbs are on the inside edge, on the lower pole of that scapula, and I have her lift her arm up, and you'll notice my right thumb jumps significantly higher than my left. So this indicates a positive test for a frozen shoulder. Now I put this clip in here because this is at the conclusion of her very first treatment. So as you can see, when I retest, her right shoulder still demonstrates that abnormal pattern, because you'll see my right thumb elevate a little bit, but it doesn't rise up nearly the way it did before treatment. So she's got a little less restriction through that glenohumeral socket, and that scapulothoracic rhythm is a little improved.
So, like I said earlier, if you think you have a frozen shoulder, go see your doc, go see your physical therapist, and you got to start exercising today, okay? Because the sooner you can diagnose this, which I've shown you a couple simple ways in which you can do it at home, even without having to go in to see your doc or your therapist, okay? And then you can start exercising, because you can take that 2.5 years and really shrink it down, okay? So I do have some exercises on my website at exercisesforpainfreeliving.com. Check it out. It's got a complete shoulder program through there. Give it a try, see how you do. Okay? If you like the video, subscribe to the channel, Front Row with Ed. Give it a thumbs up. Leave a comment if you have any questions. And good luck. We'll see how you do. Thanks.